You shared in your responses that access to healthcare for all Marylanders is a significant priority for your campaign. We know that a lack of access to healthcare is a barrier to student attendance in school, which can impede a student's ability to succeed academically. Healthcare for all is necessary to achieve educational equity. However, you ranked the adoption of a state or local single-payer healthcare option as a low priority. Why are you against a state or local single-payer healthcare option?
Yeah, thank you so much for that question. So for background, as a cancer survivor myself, as someone who used to be one of the directors of the Affordable Care Act, Obamacare, at the U.S. Department of Health and Human Services, as one of the directors of a program run by then Vice President Biden called the Cancer Moonshot, and as someone who right now works every day in a healthcare nonprofit called the National Kidney Foundation, healthcare is not only a personal issue for me, it is also a professional issue for me. I am not against Medicare for all. I just think there are other concrete actions that we can take at a statewide level that are practical, that address short-term as well as long-term solutions. Part of it is making sure we actually have reproductive justice for all of our residents, making sure we're enshrining abortion care, contraceptive care, gender affirmation treatment within our state constitution, making sure that we have free menstrual products in all of our public restrooms, making sure in all of our public health classes at school, we teach about comprehensive sex ed. That goes everything from abstinence to contraceptives, to gender identity, to domestic violence, making sure we also have lactation accommodations in all the workplaces. So that's one part of it, making sure we also invest in more community health clinics, especially for rural communities, which are typically, folks in low-income neighborhoods, people of color, and just folks who don't have access to the proper healthcare resources that they need, making sure they're getting the access that they need. Another part of our policies are making sure we replace SROs in our public schools with more guidance counselors and mental health professionals within our schools, so we actually get to the root causes of what causes a lot of kids and students to actually go through the challenges they've gone through. I grew up, I've been times when I felt suicidal, I felt hopeless, I felt depressed, and having a professional and destigmatizing the conversation around mental health